Hello and welcome to the latest Q&A with Asthma UK and the British Lung Foundation's in-house GP, Dr. Andy. In this episode, he'll be providing some guidance on what to do if you catch the coronavirus and you have a lung condition. And he'll be providing some tips on how to start getting that little bit healthier. And stay tuned for our brand new feature where one of our lovely helpline nurses will be answering a question for you, which this month should be helpful for those starting the new school year. If you need any information about anything discussed today, there are lots of useful links in the description below. And if you find this video helpful, please do let us know by giving us a like, leaving your comments, or subscribing to our channel today. And if you feel able to and you find our health advice useful, please do consider making a small donation today to help us continue defending the nation's lungs.
Andy, hello.
How are you, Joe? How are you?
I'm very well, thank you. And yourself?
Good, thank you.
Excellent. Glad to hear it. Andy, I think you know the score by now. I'm going to ask you some questions and hopefully you'll be able to answer them for me. For those watching at home, the questions I'll be asking Andy are based on the hot topics coming through our helpline and also related to the most visited pages on our website. Last month saw some major changes in the UK with the relaxing of many of the lockdown restrictions. As we know, people are now generally going out and socialising more than they've been used to. So do you have any advice for people who have a lung condition that do catch coronavirus?
Yeah, so I mean, the first thing to say is that because of vaccination and all the things that we've been putting in place over the last year by sort of social distancing and things like that, that levels of coronavirus are quite low. But as we sort of head in towards autumn and winter, and because we're mixing more, we need to be wary of all sorts of viruses spreading around. So COVID is having a little bit of a resurgence, although it's not leading to many more cases of people being admitted to hospital, and death rates aren't increasing in any significant way at all. But we're also seeing other viruses such as flu that are going to start sort of doing the rounds soon as well. So the first thing I say to people is do everything you can to reduce the chances of coronavirus spreading. Make sure that you've had the coronavirus COVID vaccine and you go for the booster when you're invited to it. Make sure you get the flu vaccine when you're invited as well, because flu is a major killer for people with lung disease. So anything we can do to prevent that going around is really important. And then going back to the basics of hands, face, space, and making sure we're washing our hands regularly, making sure that we're wearing face masks, especially in sort of crowded areas and in closed spaces, and trying to keep space between us and other people as much as possible. We don't need to be distancing ourselves particularly, but the more space that's around us, the less the bugs can spread. The worst place that where we're more likely to pick up coronavirus is in crowded indoor places where there's poor ventilation. So if you are going out and about, aim for places with good ventilation, such as outdoors, and places that are less crowded, and this will reduce your risks significantly. I'm going to continue wearing a mask, especially if I am in any indoor spaces and in any crowded areas. But certainly we're seeing those restrictions lifting, which is absolutely great for us socially, but we just need to protect ourselves medically. If you do get symptoms that could be COVID, and the sort of symptoms that we're still looking out for are continuous new cough, a loss of taste and smell, and a high temperature, then it's still really important to get tested. And if you do have any of those symptoms, then you need to start self-isolating and arrange a test by either calling 119 or going on the government website. And this allows us to stop the virus spreading if we do get it. So that's really important. If your chest symptoms are worse with your asthma, your COPD, your bronchiectasis, your lung fibrosis, make sure you follow your self-management plan or your asthma action plan if you have one. I'm seeing a lot of people who, when they start to get COVID symptoms, they forget they've got asthma or COPD or another condition, and they're more worried about the COVID side of things. But similarly, I'm seeing people who, because they've got another lung condition, they're convinced their symptoms are due to that, and they're ignoring the fact that COVID's doing the rounds. So whichever that is with you, make sure that you're investigating, assessing, and treating both conditions. Make sure if you've got an increase in symptoms, calling your GP or 111 and making sure that you can get the assessment and the support that you need. And don't wait till you've had a COVID test before speaking to somebody. It's really important that we don't delay getting treatment for your normal lung condition. That can get worse and end up making you ill and in hospital. So make sure you're assessing both and getting both treated.
So off the back of that, we know that some people are taking a bit longer to recover from coronavirus than others. So are there any resources that you could recommend for anyone who might still be feeling the effects of COVID a few weeks or months afterwards?
So, I mean, COVID can affect people in so many different ways. We're seeing people who are getting cough and breathlessness, people with fatigue, sleep problems, stiffness or muscle aches, and even mood and problems with memory and concentration. And for most people, these symptoms are very mild and last maximum a couple of weeks, actually. And the severity is reduced significantly if you've had both of your COVID vaccines. Some people, and it's not many, but their symptoms are lasting longer than 4 weeks. And if this is happening, speak with your GP. It's really important that we try and work out whether this is COVID causing your symptoms or whether you've got a side effect of COVID, because COVID can cause inflammation and infections in the lungs and in the heart and other places. But also there might be something completely unrelated that's making you feel unwell. So it's really important to speak to them about getting some more investigations. For people where their symptoms are going on longer than 12 weeks, speak to your GP and see if they can refer you to what we're calling our long COVID clinics. These are spread out around the country, and they're really important for making sure that we're treating the bits of COVID that need treating, but also that we're helping people to rehabilitate and recover and get back to normal. If you're unsure about what that means, and if you just need some further help, of course you can phone our helpline and speak to one of our expert nurses. But our website, and if you can put the link onto this, this will be really useful. Our website's got really, really good hints and tips about what to do to keep yourself going, to get yourself back to normal, and also when you need to be seeking help as well. Does that make sense, Joe?
Yeah, that's really, really helpful, Andy. And like you say, I'll make sure that all the links are in the description below. And just to say, all of the advice that we provide around COVID-19 is correct at the time of filming. And if you do find our videos useful, please give us a comment or give the videos a like or subscribe to the channel so that you're the first to hear about upcoming videos from Asthma UK and the British Lung Foundation. So for our next question, we're going to hear from Debbie, who works on our helpline. As we know, September is back to school time, and we know that every September there's a rise in the number of children in the UK who are rushed to the hospital because of their asthma. Do you have any tips for parents on how they can help their children stay well with their asthma?
Going back to school in September is an exciting time for most children. It may be that they're going back to a new classroom, a new teacher, new friends, or even a new school. Something that you can do to help your child stay on top of their asthma symptoms is to book an asthma review with your doctor or asthma nurse. The asthma review is an ideal opportunity to go through, discuss and update your child's asthma action plan. And it may be also that you'd like to complete a school asthma card with your healthcare professional that you can then hand to your child's school, so they can be really helpful. Inhaler technique is vital. You want to be sure that when your child uses their inhaler, that the medicine reaches their lungs so it can work effectively. Checking your child's inhaler technique at the review is something that should always happen, but it may be that you want to discuss a new device with your doctor or nurse, particularly if your child's going up to secondary school and they want something that they can carry easily in their bag. Requesting a spare inhaler is something that you'll need to do to make sure that the school has an up-to-date inhaler in its original box. It may be if your child's going up to secondary school that they'll be carrying it in their bag for the first time. So you'll want to make sure that you talk to your child about where to find it. Talking to your child is key because when they're at school, they need to feel comfortable with knowing who to tell if they have any asthma symptoms. If you'd like to talk to anyone about your child's asthma, you can always call our friendly respiratory nurse specialists on 0300 222 5800. Thank you.
Andy, so back to you. I'm sure I'm probably not the only adult who is thinking that September is a new year because everything's a little bit quieter now. The kids are back at school. For those watching who are perhaps thinking about getting a little bit healthier or managing their condition a little better, what advice would you give them, please?
No, you're absolutely right, and I think a lot of the advice Debbie has come out with is absolutely crucial, not just for children but for adults as well. So yeah, try and listen to some of those messages and try and see if you can apply them to you and your family as well. But as I say, it's not just children. Over the next few weeks, people are going back to work and to school after the summer holidays. This time of year, we're seeing changes of the weather, we're seeing new viruses spreading, and this puts everybody at lung diseases at risk of flare-ups of their condition. And there's a few things that I think are really important that we all sort of take stock of and we can build on as we sort of head into autumn. So firstly, I think getting into a good routine. If you've got preventer medication, take it regularly. Make sure you're checking your inhaler technique, and you can do this either with your local pharmacist, your GP, or your asthma, your respiratory nurse. But you can also go onto our website as well. Our videos have got reminders and really short, excellent videos about how you should be using your specific inhaler. Make sure that if you're invited for any reviews with your GP or your specialist, that you attend that and you get your self-management plan, your action plan updated, and keep an eye on your symptoms. Make sure that you know what to do if your symptoms start increasing and you don't delay getting help if things are getting worse. I think other things that you can do as we head out of summer is keep an eye on your diet. For many of us, we're eating more salads and perhaps eating a little bit less during the warmer weather, and we tend to eat more stodgy, heavier foods as we head towards autumn and winter. So try and keep on top of this, try and eat healthier and try not to eat too much, and that can help to keep you well as we head into the winter and to prevent any weight gain as well. And I know many people have been sort of following Asthma UK and British Lung Foundation and doing more activity over the summer. So don't let the shorter days and the change in weather affect this. Try and find a routine where you can keep that exercise and activity going. And if you haven't managed to do that, then try and build on what you do now and try and do more every single day. There's a really important part of our website on the British Lung Foundation, the Stay Active, Stay Well pages. And there's some really, really good bits on here. So no matter how fit you are, no matter how active you are, you can build on it to try and increase your fitness. And in turn, this can boost your mood. It can boost your physical, how well you're feeling physically, and make you fitter and healthier as well. So really pay some time and go visit that webpage and do what you can to try and get into a routine to be more active as we head towards the winter. And this is also a great time to look at other things as well. So if you're a smoker, this is a really good time before we hit the winter of trying to cut down and stop smoking, looking at your alcohol intake and try not to let that escalate as we're spending more time indoors, and just doing whatever we can to try and boost our health generally. And of course, there'll be invites to flu clinics and COVID booster clinics to pay attention to and make sure that we're watching the weather forecast and pollen forecast, because there's still those things out there that can affect some people's lung conditions. So there's a lot to be doing as we head out of summer, but it's a really good time to get into some new habits and to make sure they're well for what could be a very busy winter for the NHS.
For everybody watching, I'll be including some links in the description below to the pages that Andy has mentioned. Also, please give the video a like or add your comments in YouTube, or please subscribe to the Asthma UK and British Lung Foundation's YouTube channel to be the first to hear about any upcoming videos from us. Andy, once again, thank you for your time, and I look forward to catching up with you again next month.
Joe, it's been a pleasure as always, and I look forward to seeing what questions you come back to me next time with.
Thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. If you found what we've been discussing today useful, please do like the video, comment and subscribe. As mentioned, you'll find lots of useful links below. And please do remember, if you feel able to and you find our health advice helpful, please do consider leaving a small donation today to help us continue defending the nation's lungs.